Have you ever noticed how even the tiniest, most insignificant little bump or scratch on your head can bleed like absolute crazy? Seriously, it can look terrifying, like something straight out of a slasher film, even when the actual cut is incredibly minor. Well, why does that happen? The answer is actually locked inside the brilliant and surprisingly intricate biological architecture sitting right there on top of your skull.
So, let's get right into it. Welcome to this explainer, where we're going to visually peel back the layers of the human head, literally going from the hair all the way down to the bone as we explore the true architecture of the scalp.
Here is our roadmap for today. We'll start with defining the scalp, then look at the SCALP layers, uncover the dangerous layer, map out the plumbing and blood supply, look at the nerve wiring, and finally wrap up with first aid and healing.
Okay, Section 1. Defining the scalp.
Right, so when clinicians talk about the scalp, they're mapping out the soft tissue covering the entire vault of the skull. At the front, it extends up to the superciliary arches, basically your eyebrows. Then it stretches all the way to the back of the head down to the superior nuchal lines. And on the sides, it goes right up to the superior temporal line. So we're essentially talking about the entire biological roof of your head. And let me tell you, this roof is a very busy place. It's thickly covered by terminal hair, well, everywhere except over the forehead. To put that into perspective, an adult scalp hosts around 120,000 hairs, and we're constantly shedding and replacing between 20 to 100 of those every single day. Now, because it's so hairy, it actually packs the highest number of hair follicles and sebaceous glands anywhere in the human body. That's exactly why it's the absolute most common spot to find sebaceous cysts. But clinically speaking, all that thick hair means a lot of lesions or injuries can hide right out of plain sight.
Moving on to Section 2, the SCALP layers.
I absolutely love this because it's one of the most elegant mnemonic devices in all of human anatomy. The word scalp actually spells out the 5 distinct layers of tissue that make it up, from the outside in. S is for skin, C is for connective tissue, A for aponeurosis, L for loose areolar tissue, and P is for pericranium. Let's see exactly how these stack up.
Starting right at the top, we've got the skin, which is thick and, as we just saw, very hairy. Right beneath that is the connective tissue, sometimes called the superficial fascia. This layer is super dense and fibrous, and it firmly binds the skin to the third layer right below it. It's actually divided up into these little pockets containing fat, and this is exactly where the blood vessels and the nerves of the scalp live.
Now for the third layer, the A in our mnemonic, the epicranial aponeurosis. This is a tough, strong sheet of fibrous connective tissue. Think of it like a biological tension bridge, linking the frontal muscles at your forehead all the way to the occipital muscles at the back of your head. The real key takeaway here is that this aponeurosis is constantly under tension. That's why if you get a transverse cut on your scalp that goes straight through this layer, the wound will just gape wide open.
We're going to skip down to the deepest layer for just a second. The P stands for pericranium. This is essentially the periosteum, a fibrous membrane that covers the outer bones of your skull. For the most part, it sits pretty loosely over the bone, so it can be stripped away pretty easily. But at the skull's sutures, right where the bones actually meet, it is anchored incredibly firmly. So clinically, we actually divide these 5 layers into 2 functional groups. The top 3 layers, that's the skin, connective tissue, and aponeurosis, are so tightly fused together that they literally can't be separated. We call these 3 the scalp proper. If, heaven forbid, someone's hair gets caught in heavy machinery, it's these top 3 layers that are violently torn off in an avulsion injury. Below that, the bottom 2 are called the gliding layers. Because of the spongy 4th layer, the scalp proper can slide and move freely right over your skull bone.
Which brings us to Section 3, the dangerous layer. That L layer, the loose areolar tissue, is essentially this spongy, empty space. Now, on one hand, it's a huge help for surgeons. It provides this natural plane of cleavage, making it the perfect layer to mobilize scalp flaps during a craniotomy. But there is a much darker side to it. This layer is traversed by what we call emissary veins, and these veins connect the outside of your scalp directly into the dural venous sinuses inside your cranial cavity. So what does that mean? It means a nasty infection in this layer can travel straight into your brain case, which, as you can imagine, can be completely fatal.
Let's translate that into an injury we've all seen. The black eye. Say you take a hard hit to the top of the head. Bleeding often happens right in this loose 4th layer. And since the tissue is so spongy, there's absolutely nothing to stop that blood from spreading out. It easily migrates right down the front of the head and pools in the sparse subcutaneous tissue right over your eyelids. So yeah, a bump on the very top of your head can mysteriously leave you with 2 black eyes, all because this loose areolar tissue acts like a fluid highway.
All right, let's get into Section 4, plumbing, or the blood supply.
When we're talking about the scalp's blood supply, I just want you to remember the number 5. Human anatomy loves symmetry, right? And the scalp has this incredibly satisfying rule of 5s. On each side of the midline of your head, there are exactly 5 arteries supplying blood and exactly 5 veins draining it away. So 3 of these arteries sit right in front of the ear, and 2 sit just behind it. They come up from the face and the neck, literally wrapping the scalp in a dense arterial web that interconnects freely right across the midline. Guys, this is the richest cutaneous blood supply in the entire human body. And remember that dense connective tissue in layer 2? It actually holds these vessels open. So if they get cut, they can't retract and close themselves off. And that is exactly why even a tiny scratch up there bleeds so profusely.
Moving right along to Section 5, the wiring, or nerve supply. Okay, so just like we had that nice rule of 5s for the blood, the sensory nerves give us total, comprehensive coverage. On each side of your scalp, you have 8 sensory nerves. 4 of them sit in front of your ear, coming mostly from the trigeminal nerve. The other 4 are behind the ear, branching off from your cervical nerves. Working together, they make absolutely sure that every single square inch of the top of your head is perfectly wired for touch, pain, and temperature.
But hey, it's not just about feeling things up there. It's also about movement. The motor supply to the scalp comes from branches of the facial nerve. You've got the temporal branch supplying the frontal belly of your scalp muscles. That's what lets you raise your eyebrows in surprise or get those transverse wrinkles when you're scared. Meanwhile, the posterior auricular branch supplies the occipital belly in the back, which actually lets you move your scalp backwards.
And finally, Section 6, first aid and healing.
So how does all this intricate architecture dictate how doctors actually treat head wounds? Well, remember how all those arteries flow upwards from the base of the head? Because of that exact plumbing, you can actually stop a life-threatening scalp hemorrhage just by tying a really tight strap around the head, right above the ears and eyebrows. Simple, but effective. Also, because that blood supply is the absolute richest in the body, wounds up there heal remarkably fast. If a piece of the scalp is completely torn off, it should never be discarded. It should always be repositioned and stitched right back up because it has an incredible ability to survive and reattach itself.
Bringing it all together, the most crucial takeaway here is perfectly summed up by this quote from our source material. The layer of loose areolar tissue is the most important layer of the scalp from a clinical point of view. Think about it. It allows for mobility, it gives surgeons an access plane, but it's also that dangerously porous layer that can pool blood or funnel a fatal infection straight into the brain. It is undeniably the defining feature of our biological roof. So we've journeyed from those 120,000 hairs right on the surface, down through the dense aponeurosis, navigated the dangerous areolar tissue, and landed right on the pericranium resting on the bone, all kept perfectly alive by this massive dense plumbing and wiring system. So, I have to ask you, after seeing its 5 complex layers in action, does the simple skin on top of your head still seem so simple? Next time you brush your hair or maybe accidentally bump your head, I guarantee you're going to think about the SCALP in a completely different light. Thanks for joining me on this explainer. Keep learning, and as always, stay curious.